Hello, my name is Campbell, and as a marine engineer, I travel extensively overseas and also around the UK. The symptoms I had as with BPH did curtail those travel arrangements. In particular, I was experiencing frequent use of the loo. I was experiencing hesitancy once I was urinating, weak flow, a very weak flow, and also experiencing not having emptied my bladder completely. The BPH symptoms gave me interrupted sleep, having to get up maybe 3 or even 4 times a night. Also, that caused a lot of tiredness, and when the weekends arrived, I was always really quite tired and was not able to socialize fully with my friends and family. I also experienced having to go to the loo more often at work, which caused me some embarrassment and anxiety. I had to plan road trips for work quite carefully, and I selected always to go via a motorway where there were service stations available to me. I also curtailed international travel to only essential travel in itself, because I didn't feel as if I needed to be on long journeys with the symptoms I had. Following a UTI, which was not successfully treated with antibiotics, my GP referred me to a urologist. I selected the Manor Hospital, Oxford, as my hospital of choice, and Dr. Gietzman as my urologist. I then had an appointment made and came to the Manor. Having never been to a hospital before for any treatment whatsoever, I found the atmosphere really quite relaxing, and once I was in the waiting area, Dr. Gietzman arrived punctually. He was welcoming and took time to listen to my concerns. After carrying out a quick physical examination and looking at my test results, we discussed the different options available to me for BPH treatment. TURPs and aquablation were discussed. I selected aquablation as it is a less invasive procedure. It also carries a low risk of male incontinence and also a loss of sexual function. These factors were very important to me, and therefore that is one of the main reasons that I selected aquablation. Following my aquablation treatment and staying one night at the Manor Hospital, I was sent home with a catheter. Initially, I did struggle opening and closing the catheter, but very soon, perhaps one day, I managed and everything was absolutely normal. I did immediately notice that my flow rate had improved dramatically. After 5 days with a catheter, I returned to the Manor and had trial without catheter. This took about 4 hours to process, and then I went back home without the catheter, and I did notice again that my flow rate was improving even more. There was no hesitancy when passing urine, there was no pain whatsoever, and more importantly, I knew that my bladder was being emptied fully. I now notice a huge difference in my everyday lifestyle. I can go on road trips for work, I can travel internationally and not feel as if I have problems of wanting to go to the loo frequently. My night times are not interrupted. I have now almost a full night's sleep. I only go to the loo early in the morning, and therefore my tiredness has improved dramatically. The follow-up procedures I experienced at the Manor were very good. The care was available, and also both the nurses and the nursing assistants were there to advise me and to help me with anything I needed to know. Aquablation for me has changed my lifestyle completely. I would recommend this procedure for anyone that has BPH. Obviously, some treatments do vary, there are options available, but for me, The BPH treatment that I received via aquablation has changed my life enormously.